some activity or movement is better than nothing. And the more you can do, the better it is, especially when you're a survivor. I think when you're in treatment, those treatment recommendations or the exercise recommendations are going to be closer to 20 minutes a day. I call it an out and back walk, 10 minutes out, 10 minutes back. But when you get into survivorship, it's 150 minutes per week of active, moderate aerobic exercise and 2 other times during the week of resistance or strength training exercises. I think just setting a very finite goal of how much I want to do in one day. Probably no more than 10 minutes to get started once you've completed active treatment. That's a good goal. 10 minutes is a long time when you're trying to do balance and aerobic training, and then slowly moving that up. I think it's very valuable to get with a person that can train you. I think the exercise trainers have the best idea to assess where they are, where a person is. Are their legs strong enough to get out of a chair? Is their core strong enough to sustain a 10-minute walk? How are their arm strength like? If you have lymphedema, you may not be able to do the exercises with weights. You may have to just do exercises against your own resistance. I think being aware of what you're capable of doing and then beginning slow and slow, 10 minutes at a time, at 2 minutes a day, until you're at your 150 minutes a week. That's going to take a while. That's a 6-month plan. I think it's also important for them to understand. I take the word exercise out of the jargon that I use with patients. I call it movement or activity.
Smart.
Because, the recommendations for a day, it could be 30 minutes a day of exercise. But if you say movement, and you tell them, look, let's break it up into 10-minute intervals. 10 minutes, you're going to walk in the morning. At lunch, you're going to cycle a little bit or take another walk. And then at night, when you watch TV, you're going to do another 10 minutes of strengthening exercise. That makes it more attainable. And it also gives you an out. Well, I did 2/3 of that today. So that's okay too. And it's okay to be imperfect about this. I think even in our Weight Watchers group, our weight management group, a lot of our women are not able to attain that 150 minutes a week. And there's no shame. There should never be any shame about that. Movement is movement. It shouldn't be, gee, I have to put on sweatpants and spandex for it to count as exercise. It should just be, I'm going to do movement, and I'm going to do it in the clothes I wore to work today. And that's okay.
And lastly, what kind of questions should people be asking of their healthcare providers about how to start adding that exercise into their survivorship plans?
I think most of the medical oncologists are very well equipped to address where a patient is when they're in active treatment and when they finish treatment. And that's the person that the patient should start with, because they know what medications they're on. They know what the side effects that they've endured are that were related to chemo and radiation and surgery. And they need to ask succinct questions about what kind of exercise do you think I can do at this point? And do you have any ideas of where I might get started? So physicians will have in their offices referrals out to the community. They may not be able to say, here, go see this person, but they're going to have an array of resources that have been provided by oncology support services. Like in our facility, we have those kinds of resources ready to provide patients and their caregivers.